Hi, I'm Courtney Lopez. I'm doing a presentation on malignant hyperthermia for a school assignment. Thank you for joining me. All right, so the objectives of this is I want you to be able to identify 5 signs and symptoms of malignant hyperthermia, 4 ways to treat a patient who developed an MH in the OR, and also to be able to identify 2 medications to avoid in an MH crisis. All right, so what exactly is malignant hyperthermia? It's a rare life-threatening complication that may arise from medications commonly used in anesthesia. One being succinylcholine, which is a muscle relaxant, and the others listed are anesthesia gases. The ones that we typically use are isoflurane and sevoflurane. Some of the risk factors are genetic disorders, neuromuscular disorders such as Duchenne muscular dystrophy, King-Denborough syndrome, and sarcoplasmic reticulum adenosine triphosphate deficiency. Also, trauma, strenuous exercise, and emotional stress can cause this crisis. So what happens to your body during malignant hyperthermia? Your body enters a hypermetabolic state that's triggered by muscle relaxant and anesthesia gases. Large amounts of calcium is released into your bloodstream. This is done by the skeletal muscle sarcoplasmic reticulum. Large amounts of calcium causes contractions of your muscles and increases your body's core temperature. Some of the signs and symptoms are elevated end-tidal CO2, elevated heart rate, tachypnea, which in surgery, most of our patients are paralyzed, so you may not be able to see this. It also causes muscle stiffness and rigidity, hypoxia and cyanosis, cardiac arrhythmias, and rise in body core temperature. Also, rhabdomyolysis, breakdown of muscles, and which causes a large amount of myoglobin to be excreted in the urine, which can cause the colon colored urine. Also, hyperkalemia, hypercalcemia, metabolic and respiratory acidosis, and lactic acidemia. So what are we going to do when this occurs? First of all, call for help. Get the MH cart, which is located outside of OR 7. Stop anesthesia gases immediately, and if sucks is being administered at the moment, you need to stop that as well. Administer dantrolene, and the patient needs to be hyperventilated with 100% oxygen. If possible, stop the procedure. If they're not able to stop the procedure and the patient has to stay open, you need to pack the wound with cold saline and laps. You can apply ice packs to the patient's axilla, groin, and neck. You need to insert an NG tube and a Foley, and you can irrigate through both of these things as well. And then you also need to notify the house supervisor and call the MH hotline, and they can further assist you if needed. So this is a picture of our MH cart, which is outside of OR 7, like I said. That's it for that. Okay, then we're going to talk about dantrolene. This is the medication of choice to treat this emergency. It is used because it directly affects sarcoplasmic reticulum. It controls the release of calcium, resulting in normal level of calcium in the skeletal muscles. It has to be reconstituted with 60 ml of sterile water, bacteriostatic free. You have to mix this vigorously for several minutes, and the appropriate dose is 2.5 milligrams per kilogram. There's also medications to avoid. Typically in our OR we use Plasma-Lyte. They would like you to not use LR or Plasma-Lyte. LR can exacerbate lactic acidosis. And then also to avoid calcium channel blockers, because this can cause cardiac arrest and hyperkalemia when given with dantrolene. So they would like for you to use beta blockers instead. All right, so what to do after an MH crisis occurs. Patient needs to be transported to ICU. A complete incident report needs to be filled out, including the patient's response to intervention, the time of events and treatment, and the staff that's involved. This also needs to be reported to North American MH Registry and notify Central Sterile Processing to restock the MH carts. This is a picture of the handout. You can keep this on you. Gives you some information, pretty much exactly what we went over. And then the conclusion. So malignant hyperthermia is a true emergency that requires a coordinated team effort to treat patients successfully. Since this is such a rare emergency, it's critical that we re-educate ourselves so that we can treat our patients effectively in a timely manner. Thank you for allowing me to present this information to you. I hope you will be able to take this knowledge and apply it to your practice if there ever comes a time when your patient experiences a crisis. Thank you.